Hi, and welcome to Pierpont EMS, Pierpont Community and Technical College's EMT and Paramedic Training Center. This is the Preceptor orientation for 2022. I'm John Hitchens. I'm Program Coordinator and Educator for Pierpont Community and Technical College. Thank you for choosing to participate as a preceptor for our EMS students. Your services provide a major component for the success of our students. By participating in this, you are paying it forward for all those who have helped you get to the point where you are. The purpose of this training is to instruct EMS preceptors in the requirements and expectations of their roles, as well as that of the student, to ensure consistency and provide accountability of all preceptors, and is a requirement for accreditation for the paramedic program. The student shall arrive promptly. The student should be dressed appropriately. Pierpont Community and Technical College polo for paramedic students. Appropriate pants, foot attire, and identification for all students. The student shall maintain good personal hygiene. Perform assessments and skills under direct supervision of a preceptor and be an advocate for their patient. As indicated here, the Pierpont Community and Technical College's polo. Appropriate pants, appropriate foot attire, and their ID badge. Students shall abide by all agency and departmental policies, including those with respect to COVID-19. The student shall represent Pierpont Community and Technical Colleges to the highest degree. Any deviation from these standards must be reported on the student's evaluation forms. Do not hesitate if you feel you need to submit a form directly to either the clinical coordinator or to myself to do so at the email addresses listed on the last slide of this presentation. The preceptor should be a role model and lead by example. Instill a sound foundation for the student moving forward through their EMT or paramedic education. Supervise and educate the students. Provide positive and constructive feedback. Ensure students abide by policies and procedures and maintain a high level of moral and integrity when filling out student evaluations. Remember that once these students become paramedics or EMTs, they are a direct reflection of you. Field preceptor and crew configuration. The crew must consist of a minimum of 3 people. The paramedic preceptor must be working at their current level consistently for a minimum of 2 years, or 750 ALS calls. They must be approved by the clinical coordinator, and they must be paramedics only. EMT preceptors can precept after 1 year of experience. Preceptors must be in good standing within the West Virginia Office of EMS System and your respective agency. The preceptor should oversee the student in conducting patient assessment and treatment. Care should be conducted by the book, no shortcutting, as the goal is to create competency. The students are still in the learning and developmental stages of their EMT or paramedic education. A preceptor should only allow a student to perform a skill or medication if they have been signed off to do such on the skills evaluation authorization form and the medication administration form. At the beginning of the shift, the preceptor should review with the student their baseline knowledge, skills that they are able to perform, meds that they are able to give, and areas that they may want some assistance. Discuss with the student what their role is going to be. Familiarize the student with different facilities, location of supplies and equipment, involve the student in apparatus checkoffs if applicable, and make the student feel welcome. Paramedic students should arrive with their medication administration form. This form indicates all the medications that they have been duly trained and checked for competency, not only in their indication of use, but how to use them. The skills administration form indicates that those skills are available for the paramedic student to utilize while doing ride time. During your shift, you should use every patient encounter as an educational experience. No matter the nature of the call or chief complaint, there's always a learning opportunity. Remember, you are the expert in the student's eyes. Let them gain experience. Use downtime proficiently. Mentor the student in areas they are covering in class or any areas they may have questions about. Time is a crucial factor to the student. Don't let any of it be wasted. The completion requirements, for paramedic only, indicate the minimum number of calls the paramedic student should run in each specific category in their pre-hospital field clinical time. Questions always arise about what designates a call to be ALS. For the purposes of Pierpont Community and Technical College's paramedic program, an emergency response with patient interview and physical exam, and a successful IV or IO access and an ECG, or medication administration, intravenous, intraosseous, or intranasal, and an ECG, or successful IV, IO, and medication administration. Oxygen or ODT Zofran will not count as an ALS medication. For EMT patient assessments, they need a total of 10. One patient equals one assessment. They should be allowed to intervene within the West Virginia Office of EMS BLS protocol. The patient contact form is used as the student's PCR, one PCR per patient at the paramedic level. The patient contact form for EMTs looks slightly different than that of the paramedic students, but they are also used as the student's PCR, one PCR per patient. Student evaluation. Please take the time to complete all forms. The shift evaluation of the student, the field evaluation, team leader evaluation. Student evaluation forms must be signed. Please leave comments and please be honest. The field evaluation form is completed for every call where the student serves as the team lead in the field, at the paramedic level only. This form is broken into multiple categories, 5 being the best, 1 being not acceptable. The dimensions of team leadership, seen size up in management, initial assessment and patient interview, examination, treatment plan, communication, skills, and leadership are all areas that we ask for you to score. The student evaluation form is completed at every clinical site which they attend, at both the EMT and paramedic level. There should be one form per shift. Again, this is split scored with 5 being the best and 1 being not acceptable. We ask that any score less than 3 have comments in the comments section. We ask for you to evaluate the student in the areas of integrity, empathy, motivation, confidence, communication, time management, advocacy, knowledge, and performance. The next section of the precepting program is the paramedic capstone term. And again, this is for paramedics only. The purpose of this section of the course is to instruct EMS preceptors in the requirements and expectations of their roles, as well as that of the student during the capstone field internship, to ensure consistency and provide accountability of all preceptors, and is a requirement for accreditation for the paramedic program. What is a capstone? COAMPS, or Paramedic Program's accrediting body, defines a capstone as activities occurring toward the end of the educational process to allow students to develop and practice high-level decision-making by integrating and applying their paramedic learning. The student role during this capstone term is that they must be the leader of the team. They orchestrate and lead overall patient care of the patient. They are not required to personally complete all of the ALS skills on the call, but they must function in the team leader role. The preceptor in this phase of training should be a part of the team. They should let the student take charge and be a good partner, provide patient care as needed, ensure proper treatment of the patient, and ultimately evaluate the student's competency. The completion requirements for the capstone term are listed here. In that fall term, they are required to get 25 team leads. An ALS team lead is an emergency response with patient interview and physical exam and successful IV/IO access and ECG or medication administration, IV, IO, or IN, and an ECG, successful IV/IO and medication administration. Oxygen or ODT Zofran will not count as an ALS medication. Skills can be performed by the student or the preceptor. Again, during the capstone term, the paramedic students are being evaluated on their ability to lead the team, not necessarily skill per skill. The team lead evaluation is completed for every call for the paramedic student when they serve as a team leader in the field during their capstone term. At the completion of the shift, the student should report to their preceptor prior to leaving. It is the responsibility of the preceptor to ensure the student fulfills their entire shift, unless other arrangements have been made. The preceptor shall be responsible for filling out all evaluation forms. Feedback should be given to each student. Correctional feedback is always done in private. Positive reinforcement can be done in private or in front of others, depending on the personality of the person receiving the reinforcement. Students are required to scan and upload all forms into the FISDAP program. They may ask to utilize an agency scanner. If one is available, we ask that you assist them in uploading those forms. For any questions related to this training, or to any student that you may have, or any issues that arise during your shift, please feel free to reach out. Rusty Taylor is the clinical coordinator for the Pierpont Community and Technical College Paramedic Program, and I am the program coordinator. And we are more than happy to answer any of your questions or deal with any issues that may arise. Again, thank you for participating in this preceptor training for the Pierpont Community and Technical College EMT and Paramedic Training Program. We look forward to you working with our students soon.